Okay, welcome to the class, Public Health 1 again. So please, here are also still chairs available. You will be first here in the line, so that will be good. We can have good interaction. If you can now, here are more seats, please. So here is one, here is another one, please. I would like that you will feel comfortable during the class, okay? Before I will start, I would like to ask you any questions so far. Any questions regarding the paper? You also received the information from Jamie, your teaching assistant, about checking the draft for the presentations, the draft for the paper. There are specific deadlines if you would like to that the drafts will be checked. So that I think the email was sent today, is it right? Do you have any additional comments you would like to let them know? That's
just the sign-ups are up there, so please sign up for your group presentations as soon as possible. Most of you have, but the few of you who haven't, that would be great.
Yeah, remember, the sign-up sheet, so we will be probably closing that quite soon, so if you can please put your name there, because in the beginning of the next week you will start to work in the group and prepare that, especially for group 1 to 5. The deadline is coming very soon. I know it still sounds like, oh, now we are in the week 1, but this will be in the week 5, so we have a lot of time. But I can assure you that the time is flying. It's going so fast. So please be aware about that and put your name now on the sign-up sheet. So now we are in chapter 1 talking about public health, science, politics and prevention. So what is the meaning about that? Before we will go to that, I would like a little bit to talk about the health. Health on its own. There are many different definitions about the health. What do you think if I ask you, do you think, are you healthy? What will be your response? What you will tell me about that if I ask you, are you healthy? Any of you like, well, I'm asking the whole class, everybody here, do you think that you are healthy? Yes. Yes, okay. Because of what? Why you are thinking you are healthy?
We're able to pursue higher education comfortably.
Okay, that's one. Okay, so you are able to go for the higher education. Okay, yeah, that's right. That's very good. Okay, another thing? Why you do think you are healthy? Yeah.
I think everyone here looks very nourished, like no one looks malnourished or anything.
Okay, so that's good. So it looks like the physical portion of that, so that you look like, yes, everybody is like good nutrition. Okay, that's good. Okay, another, one more, 3 times. It's good. Yeah.
Well, I don't know if you can actually say that everybody's healthy, because physically everyone can see, like you can see they're well nourished. But maybe there's somebody who's struggling mentally, just had a breakup, or maybe someone who's struggling socially. They don't have any friends because they're new, spiritual, maybe they're still looking for their religion. So just because they look healthy on the outside, it doesn't mean they're so healthy on the inside.
Okay, thank you so much. So you are almost getting A+ for this answer. Okay, I'm so proud of all of you with getting these ideas, because and you can practice this question with a little bit maybe with your parents or grandparents, a little bit older population. If you ask them, are you healthy? Mostly they will respond like, well, I don't have any pain, so I am thinking that I'm healthy. And that will be actually insufficient answer. So that will be not enough. That will be meaning the person is only thinking about the physical health. And as your classmate already mentioned, talking about also about nutrition, about the social communication, about that mental health and all that things. So it's actually then when we talk about definition of health, there are more things involved in that. And actually I will be sharing with you the information that there are 7 dimensions of health. And this will be quite, like you can do the homework for tonight and ask, people, or maybe to call your parents, oh, Mom, do you think you are healthy? And she will tell like, yeah, I am, or maybe not. So you ask why not? And you will be surprised. Maybe there will be the physical, connection like, oh, I have pain or I don't have pain, but not other things. So this is the World Health Organization definition back like 1945. So you can see they already started to put additional things there like physical, mental, social, spiritual well-being, not just the absence of the disease. And then what is actually health also? It's the state that you always have to take care of that. It's never ending. So when we will be talking about the diets, that is the beginning and end of the diet, so it's not actually the lifestyle. And sometimes it's quite paradoxical. You can hear from clients or from the patient, they will tell you, yes, now at this moment I'm on the diet, but I am dying. When I finish the diet, I can go for the piece of cheesecake, okay? So what is that? This is really diet. It's not the lifestyle. And you as a public health professionals, you need to be involved in lifestyle modification, lifestyle medicine, not just like having some kind of so-called like a quick fix or having something like it starts and it ends immediately. The lifestyle is forever. You can always improve. You can always have additional hours of sleep. Or you can always have additional minutes of walking and physical activity. You probably can always have additional time to do something about the stress management because of the things that the life is bringing. So we always have to be in that process. So now talking about the dimensions. So you will probably notice that sometimes I will tell you, well, this is the PowerPoint slide here, that if somebody will wake you up in the middle of the night and ask you what are the 7 dimensions of health, please, you need to know that, okay? If I mention that, it's almost guaranteed that this question will be on the midterm. So you see, you already have the study guide here. So 7 dimensions of health. Your classmate already started to talk about that. Emotional health, and you notice that because if you will have lower self-esteem or you have emotional like not completely in the balance, it can occur that you feel like depressed and all other things. You cannot study properly, and it's influencing the whole your the level how you recognize your health. So emotional health is very important. So you need to, from the public health perspective, to be sure that the public is emotional healthy. I mean, on the general level as a public, but also on individual level. Intellectual health, to have open mind, to be open to new ideas, to new things. And sometimes you have the experience with some people that you talk, you are excited about your ideas, and they are not open to that. They are just like narrow, and you are like, well, I don't have any power, I feel powerless and hopeless, I cannot, discuss that. So it means that the person is probably not intellectual healthy, because it's very important. And sometimes it could be like we have some kind of declining things because of the aging process. So sometimes the intellectual health is declining in that way that through the aging also, that some population don't want to do the changes. They are not open to new things, because sometimes it could be fear also, or not having enough of information, education. So that could be the reason. So you as a public health providers, that's also your responsibility to help people to be intellectually healthy. Spiritual health, what is the meaning? What are my directions in my life? It's not always connected with religion. It's spiritual things on its own also. And, sometimes you talk with people and they have no idea what they will be doing in their life, or they have no perspective. So if situation is like that, it can also influence health on its own. Or sometimes I talk with students, and I'm asking them, what would you like to do? What will be your profession? What you are looking, forward to do when you graduate? And sometimes they don't know. Sometimes they think like, well, in my family, everybody was medical doctor. So it's supposed that I should go to medical school. And I ask them, is it something what you really would like to do? Can you see yourself in this way? And it's not always sure. So if you are asking the questions like that and it's not sure, try to find out what is really, meaning the directions in your life. It's very important. Occupational health. This is of course connected with your employment. So please try always completely to pick up the work, the job that you love. It's close to your heart. Because remember, I know now it looks like, well, 4 years I need to graduate, and maybe another 4 years to do the graduate school or anything like that, and then I will see. But try to pick up the occupation that you will really love, that it will be your hobby, because you will be involved in that for another 30, maybe 40 years in that occupation. You have to get up in the morning and thinking, yes, I'm going now to the office, or yes, I'm going to the medical office, I will be working with the patients, I will be doing this. If the occupation is not close to your heart, is not your hobby, you will be miserable. So please think about that too. And you can see actually this example that I mentioned last week, that public health profession is a little bit different in that way, that you have to be as a role model. So you have many of the things you have experienced on your own life, and then if you have connection with that and you know how important it is, you can get this message also to the public, and through the whole level as a public or on individual level. So occupational health, so this is something I have to really share, and maybe you already noticed that I really have passion for public health and I really love teaching. So I get up in the morning and I'm looking forward, and I will see you here and I will be sharing the information with you. So I'm so excited. So actually I am fortunate in the way that the occupation, what I'm doing, is my hobby, and I love to do that. I'm just not thinking like, well, this is another working day. I'm just enjoying every working day. And if during the time that you are on vacation, like Christmas time or the summer, no students on the campus, so I feel like, wow, it's so empty. I miss my students here. Okay, so if you are getting in similar way with your profession, so it means like, yes, that's fine. Of course you have to, and you are always thinking like how to make money and get the money from your profession, but it's not just about the money. You need to have that, but you need also to love your profession. So be sure about that. Social health, yes. Interaction with other people, relationship. If you are, especially I have also the class that will be in the spring 2013. It's called the Public Health Communication. And this will be talking about the interaction and communication with others. So be sure that you really are listening properly. If you are not judging quickly, if you are not doing assumptions quickly, because from this can happen miscommunication. And you can see physical health, that majority of people are thinking about that. It's just one portion of that 7 dimensions of health. So physical health, it's that one that how you are able to do the regular physical activity. And this physical health, it's connected something that older population will tell you, yes, I'm healthy, I don't have pain in my knee, and I don't have pain in my back, and I don't have headaches, so I'm healthy. But it's just one small portion in that. And of course, environmental health. Partially you can influence that, partially not. Yeah, question?
A quick question about physical health. You say it's to perform normal activities of daily life. But when you think about it, there are some people who you could say are not at the prime of physical health. They're a bit chubby, yet they can still perform normal activities. What would you say about that? Would they still be considered healthy in the spaces?
Yeah, this is very good comment about that. I mean the physical health in the way that they also base on that all other measurements when we do like body mass index and all of that nutrition. So it should be connected with that. So the physical health is how they are, following that some kind of definitions of being like having the healthy body. So if they still perform normal activities, actually very good comment on that, because thinking like, oh, I can just perform normal physical activity, but is it that normal activity that I would recognize that is healthy physical activity or not? So yeah, so I would, it's just the general point here in physical activity, but we can go under the steps on that. And we will discuss this portion more when we have the physical activity, exercise, and that the section on its own in Public Health 1. But this is very good thought about that. Thank you. Yeah. So environmental health, partially you can be involved in that. When you are thinking partially, we cannot completely to be involved in that because it also depends on the government, what kind of protocols they suggest, or they sign and do specific public health policy. Partially, of course, all public could be involved in that, because if you start to explain and showing that yes, we need to do some changes and keeping our environment healthy, then of course it will take process, but there will be the public health policy things that they will keep the environmental healthy. We will talk a little bit more about that also when we will have the special section about environmental health, like how to keep the water clean, the air clean, also your backyard clean. So there are many things that can be partial influence on individual level, but also on the government level or the city level or the community level. So there are 7 dimensions of health. So I try a little bit to spend more time on that because it's crucial. We will be returning all the time to 7 dimensions of health. And if somebody will wake you up in the middle of the night again, please know what are the 7 dimensions of health. Public health on its own. If I will tell you public health, do you have any ideas, or when you were thinking like, oh, I would like to do the public health major? Any of you, I would like to ask you, what if it's coming, or you ask the question, what is public health? What's coming to your mind? I know some of you were last week on Monday in introduction to our department, and this question was asked by our chairman in the department, and I'm asking that question again. So when we talk about public health, or you were thinking, oh, I would like to do major in public health, what was in your mind? What you were thinking that maybe you will be doing? Any comments? Yeah?
Disease prevention in the community and promoting wellness.
Okay.
In the community.
Okay, so this is excellent. So preventative things with the diseases, yeah, okay. So other things. Yeah,
Helping people who can't really help themselves.
that's very good, and it's very urgent point because we have now a lot of education on its own, but we don't have enough of public health promotion, and we don't have enough of public health specific strategies, how to do that, how to improve that. So the behavioral part, yeah, that's excellent, yeah.
Maybe even increase like life expectancy by doing a lot of research that prevents like not only diseases but you know, maybe figure out like epidemics and all that, which it's better to prevent than, you know, actually get to that and then try to cure it somehow.
Yeah, this is an excellent point also. So life expectancy, and I will add there, improve the quality of life. Okay, so not that expectancy, because I mean through the technology, and it's good point because I was thinking that you were thinking it's quality of life too. It's not just extend the expectancy, the longevity, but you would like to improve the quality of life too, because you don't want to have just more years, maybe 10 additional years, and going twice or 3 times per week to go to the medical office and taking medication. So that's not, you know, I don't recognize that in the way as improving the quality of life. So that's expectancy together with quality of life. Yeah, okay, any more? Okay, so you are in the right track, so this is good. So actually you will find out through this class, the public health is everything around you. It's all the things are, of course, the most important thing is to improve the quality of life of the public, and you will find out that almost everything around you, it's connected with public health. So if you look on this historical point, so it's almost like 100 years back, that was the first master degree in public health. So in the beginning, in that time, was connected with sanitation, with hygiene. So they didn't think too much in that time about preventative things of the diseases like lifestyle modification. Mostly it was like how to prevent the infectious diseases. I already asked you the question about what you think about public health. So yes, this is actually connected with public, to educate them that they will be keeping the healthy lifestyle. So hopefully they will be keeping that 7 dimensions of health and, you know, going through the whole process. When we talk about preventative things of the diseases, we will be talking about acute diseases, so prevention of acute diseases and prevention of chronic diseases also. It was not very common, if you think even maybe like 30 years back, chronic diseases were not in high occurrence like in the current times. So we have more problems with current diseases because of type of the lifestyle. So this is the care that I would like that you remember that, and I would like to share the story with you. I also do continuing medical education with physicians, and one time they wanted to have the topic about. Of course, they always like to have the topic about the fountain of youth. So, fountain of youth, even from historical points, many people wanted to find what is the fountain of youth. And it's actually very easy. It's lifestyle modification. And so I prepared a presentation that I call that like typical aging versus normal aging. And I know many times the director from that medical center called me and told me, well, you did some kind of mistake. Typical and normal aging is the same. What are you trying, to explain here? Didn't you do the mistake? It should be just like, you should just call it like fountain of youth, or why you are calling that typical versus normal aging. And I told them, well, just wait, I will come there. Before I will share that information with you, any of you have ideas? Are there differences between typical aging and normal aging? Or do you think it's just the synonym, it's the same? How many of you think there are differences? Normal and typical aging. I think you probably now agree with me because I already started to talk about that. Any ideas what maybe I can talk about that? Typical aging and normal aging? I would like to share that with you if, and maybe you have the grandparents and they are complaining like, well, I have arthritis and I have that pain, what can you expect? It's my age, so everybody has that. So this is so-called a typical aging. It's not normal. The normal aging is the way that you are, of course, decreasing the functions because of that, aging process. So physiologically, we are decreasing the function. But it doesn't mean that immediately there is the occurrence and symptoms of the disease. It's not necessary that everybody needs to have, arthritis and diabetes and obesity problems and going on and on. So it's many of the things with that normal aging is how you add your lifestyle modification. Of course, some of you will argue with me, yes, what about the genetic materials? Yes, of course, there is a certain percentage of genetic materials, but we know now from the public health science and science on its own that you can decrease the symptoms or occurrence or presentation of that disease even if it's running in your family. Because the beautiful thing is that through lifestyle modification, you can influence the mutation of the genes. So what was not thinking maybe 10, 15 years ago, they were thinking, well, if there are genes in that way, there is no way that can be influenced by lifestyle modification. Now we know through proper eating style, antioxidative diet, anti-inflammatory diet, we can lead the way that even if the family there is the higher risk of diabetes, but the symptoms of that person, if it's keeping the proper and balanced life of the lifestyle modification, maybe the occurrence of diabetes is postponed. So instead of occurring at age of 50, it will be occurring at age of 80, or maybe the symptoms are on the lower intensity. So it's not so strong that immediately the person needs to go for insulin injection. So that's the beauty of the public health. And as one of your classmates mentioned, it's very important now to do how to change the perception of the public, that the public will be willing and realizing, well, these are no side effects, it's actually educating instead of medicating in public health. I can change my strategies and I can understand that and change my lifestyle modification and having this good quality of the life. So this is something that is quite crucial. It will be a huge challenge for you as a future public health providers, how to help public to change that behavioral part. So this is really crucial in public health. I'm just looking at you because you mentioned that you're one of your classmates. So when you see these cares, and it's almost guaranteed that will be also on the midterm, be sure that you know that this is the typical care, so it's not involvement so much of the lifestyle modification. As you can see, we are still extending a little bit the years to compare that was maybe 20 years back or 30 years back, but we are not too much improving the quality of life. So we would like to do something what is normal or almost ideal. This is a little bit that the person is or the public is in the middle of that, accepting partially the lifestyle modification. So if you can see that it's big difference between typical, accepting that, and completely like the ideal level of that. And again, people think sometimes, well, when to start with to have with the lifestyle modification. To have the best results is good to start as soon as possible. Even from the time when you start to, you are born. So that will be the best way to start with lifestyle modification, but I know you are not on your own. It's influencing your parents, so you cannot completely take care of your lifestyle. But it's, some older people will tell me, oh, it's too late now. If I smoke 30 years, that doesn't make the difference. No, from public health perspectives, any changes are making the difference. And we will talk about that later also, especially with tobacco. You can see immediately changes in a few hours, few days. So it's never too late to start, with lifestyle modification. Okay. Any questions so far? Yeah.
So the middle line basically explains you said the normal kind of.
Yeah, so the pessimistically optimistic, so it means that there's some group of people that they realize, well, we have to start to do the changes a little bit. The typical is no changes whatsoever. So they are, it's the way that they think like it's normal, I have to have arthritis, I have to this. And it's hard when we will be talking about the behavioral model. So they are in that level that pre-contemplation, so it means nothing at this moment. There is no way how we can explain the person that is very important to change the lifestyle that can influence the outcome of the disease. They are completely not accepting that, and there are people like that, and so it takes time. And sometimes theories were like, well, we have to leave them as they are. But now the new things are, well, maybe we need to find the new tools how to help them. Okay, so this is this group. Then in the middle, so they start to do something a little bit. It's still not completely in the balance level. What they could do more. So if they do more, then is the next curve. But sometimes, of course, it could be if it's very, very strong genetic approach for the specific disease. So sometimes it's not completely possible to go to the ideal care. But if the person has a very strong genetic material for specific disease and they do lifestyle modification, they can get much better still than just the typical. Okay, so please remember that also, because it's almost guaranteed you will have that on your midterm questions. I'm adding few things that you don't have in your textbook, and especially during the chapter 1, because I think it's quite crucial that you have a little bit additional ideas what everything is possible in public health. And you are actually in the new generation in public health, so I think the trend will be in that direction. So any of you know what is the abbreviation? CFS, yeah?
Chronic fatigue syndrome.
Yeah, excellent, yeah, that's true. So, and maybe you were able to hear, like in the current or recent time, last probably 10 years, 15 years, everybody's talking about headaches, everybody's talking about fibromyalgia, and everybody's talking about chronic fatigue syndrome. I know you can probably identify a little bit with tiredness, especially maybe around midterm and after 10 weeks in the course, you will be like tired and thinking, oh, I'm chronically tired. Well, it's not probably completely connected with the disease, because that is the specific definition, how many months you have to be tired and specific symptoms of that. But generally, this was done, I did like a little bit analysis of the research connected with chronic fatigue syndrome, and why I am showing that to you as a future public health providers. Because if you look on that and you check the literature, you find out that people having problems with chronic fatigue syndrome, they are deficient in many of these dietary, components. So there is not enough of folic acid, B12, vitamin C, magnesium, omega-3 fatty acids, sodium, it's even too much or very, very low. So there are extremes, and deficiencies in water. So if you look on that, And you remember that some of your classmates mentioned, well, how we persuade the public to be involved in that healthy health behavioral. So if you look on that, you can almost do like, I think partially you can do scientific assumptions from that, even it's not connected completely assumption and scientific, but this was the information, the analysis from scientific papers, that people were probably not eating enough of fruits, vegetables, grains and beans, because how come? I mean, or you know, nuts like omega-3 fatty acids, walnuts for example, they are connected with omega-3 fatty acids. So it's almost like obvious that nutritional part was probably quite important component with connection chronic fatigue syndrome. Then if you look the other underlying health problem, so if you look like depression, constipation, so some of this could be connected with not enough of exercise. People are, you know, surprised like how come I have problem with constipation? Low intake of water, no physical activity, and maybe, yeah, that's mostly. With depression, maybe not proper way of the stress management, chronic lack of sleep. So if you look, some of them are hypoglycemia, chemical sensitivity. Some of this, of course, they are connected with that, but some of them is again behavioral modification. So if you look on that, it's lifestyle modification. And many times I'm surprised, in the past I was invited for the community that was in the medical centers, in the hospitals, to have, you know, presentation about chronic fatigue syndrome. And so of course, if I had a presentation, they always do refreshment. And I didn't have the possibility to talk with the administrator to prepare the specific refreshment. And I was always surprised. I came there, I wanted to talk about chronic fatigue syndrome, knowing, yes, there is the compromise also of immune system. So it means it needs to be here, fruits, vegetable, grains, beans, or juices. But I was surprised. The refreshment was chocolate chip cookies and coffee. So is it conspiracy? Does the medical, you know, the hospital would like to have the patients and make the patients, therefore they are offering this type of the food? Well, I was always puzzled about it, but I was thinking like, well, how can I do the presentation? So I couldn't talk so much against the hospital, but I wanted to tell the truth to the patients. Of course, we have to tell them the truth. So be aware about that. Be aware also in case you will start to feel tired. Check how many bottles of the water you drink. And you will be surprised. Maybe you didn't notice that. Maybe you didn't drink enough of water. So immediately when you start to feel a little bit tired, drink the water and you will be surprised that you will get the energy back. And check like what was the food that I was eating today. Is it possible that I have some deficiency, some of that type of the food that is connected with tiredness, okay? And how many hours, of course, did you sleep? So I transferred the Shakespeare. You probably know Shakespeare, to be or not to be is the question. So I changed that to be tired or not to be tired. And so I think it's mostly always the important question for students, being tired or not to be tired. So be sure that from this modification to ask yourself, how many hours did I sleep? And don't think like, well, but there is no way, I really cannot sleep more hours. If you change your priority and you add more hours of the sleep, you will be surprised. You will be really fresh, you will have a lot of energy, and you will finish the amount of the work that you need to finish. It's not, it's misleading that people think like, well, if I will spend more hours and I will do the work, I will finish the work, you will be miserable the next day and you will get to the chronic deficiency of sleep, and you will need more and more hours and less for the work and less hours for the sleep, and there will be the cycle like that. So try to break the cycle and be more, you know, energetic. The coffee or caffeinated drinks, sometimes, you know, it's also connected because coffee sometimes works in the way as a credit card, okay? You are taking additional coffee in the morning just to have enough of energy, but it's like the depth of the energy, like the credit cards, depth with the money. So you take more of the coffee in the morning, and remember, what is the coffee doing? Fight and flight response. So it means that it's all the energy that you have for the whole day, it's concentrated in the morning, and then you are depleted again in the evening, and you go for coffee again and again. So then you are taking your reserves from the energy that maybe you have for the 10 weeks to be in the class. So be aware about that too. I know that sometimes it's the psychological things that you feel like, well, I need to have that 1 cup of the coffee in the morning, but be aware if you add more cups of the coffee, in which way, what are you actually doing to your body? So be aware about that. Just sharing with you the story when I was working with my patients. Of course, I already told you that I was working to preventative things with headaches and migraine headaches especially. And I had one patient that she was drinking 15 cups of coffee and she was complaining about headaches. No wonder, okay, you are laughing about that, but the patient was like, well, you know, I don't know why I have headaches. So what should I do? Should I tell and the patient, when was coming to my office, she was telling me, well, when you will tell me I should stop drinking the coffee, I'm leaving. I will be not in your office. So I thought, okay, I cannot do that in negative approach. I have to do some changes, the behavioral modification. So I told her, well, is it possible that before every cup of coffee, you will finish and drink 1 cup of water? Okay, so that was another strategic point. And so she decided to do that, and she returned after another like 4 weeks, and she was able to decrease from 15 cups of coffee to 5 cups of coffee. It's still a lot, but she was excited. She had less headaches, and she told me, you know, actually I think I was thirsty, and I didn't realize that I can drink water to, you know, yeah. And so she was going always for some liquid, and the liquid was coffee, okay? So I know you are laughing, it's just like a very amusing story, but they are like real stories like that. So be aware that situations like that happen with patients. So this is again, what is actually the public health? So it's like the obligation, all the things, to improve the quality of health for the public, improve the conditions, many things that the public is living. So it means, of course, even if you look like now when you are buying whatever product, nutritional product, the labels there. So how much of the sugar is there, carbohydrates and everything. So it's giving the information to the public that they can be involved, actively involved what they are consuming. Also like Clean Water Act to have drinkable water, public health infrastructure, doing the vaccinations and everything. So public health on its own, it's really, you know, taking care of the public to improve the quality of life. So what do you think? Do you like that picture? Oh, a lot of colors here. So if you look on that, it's just making you smile on your face. So I hope, I know that when you finish this class, maybe 1 hour or 2 hours, we will have your lunch. So I hope that you will try to pick up some kind of nice colors for your lunch that will cause the smile on your face. Actually, sharing another story with you, I have one patient that he was actually quite old. He was like 90 years old, and he just came for the lifestyle modification consultation just to check that, to be sure that everything what is doing in the right direction. And of course he was already 90, walking, you know, not having chronic diseases, so he was doing something right. And he was sharing information with me also that he is eating based on the colors. Okay, so he always wants to have the 5, 6, 7 different colors a day. So it means, like, if you look on that, so it's representation of some type of vegetables, nuts, you know, everything what is from the plant origin. But what was quite interesting was when I was sharing a few years back in one of my class the information about it. It was in my nutrition class, and some students asked me, wow, we like that theory. So does it mean that we can have brownies because it's brown color? No, please don't do that, okay? So I just check if everybody's awake, it looks like, okay. So, very important thing, if somebody will wake you up in the middle of the night, you need to know the core functions of public health. assessment, policy development, and assurance. So how you compare that with the medical system, medical care on its own? Assessment, it means like, it's almost like the diagnostic procedure. So if the patient is coming to the doctor, they try to find the diagnosis. So public health is doing the assessment. It's very easy if you can see that like on infectious diseases. You have the different tools, epidemiological tools or anything to find out what is the problem. Now, what needs to be done about policy development? Policy development is the treatment in the medical care or recommendations and so on. And then assurance, so it means that we are really be sure that the public health policy, if this was established, it continues in the way. And so, for example, if we know like tobacco is detrimental to the health, public health policy, you can see that on the door also, like how far you can do the smoking from that buildings. And assurance, like yes, it's the public is keeping that, following that, and with explanation. So you need to know the core functions in public health and how to compare with medical model. So this is something that I already shared that with you. Here is a little bit more described, but the basic information we just told you, that was the differences between public health approach and medical care approach. Many times when we think about public health, so of course it's on the public level, but also it can be on the individual level. Because if you do that individual level, then you are using the networking, and that one individual can talk about that and doing actually public health work and talking about that information. So now talking about the public health science and politics. So we need to have public health science. Some of you are as majors in public health science, so you need to find out, and you will see the different disciplines in public health, like epidemiology, helping you to find out the trend of the disease or to find out what is behind that infectious disease or the trend with the chronic diseases. So we need to have that. We need to have the public health policy. And unfortunately, many times it's also connected with the politics. When we talk about that position as the Surgeon General, a few years ago we have invited the Surgeon General was here and talking about the approach of Surgeon Generals. So they are always staying on the side of the public. So if there is something what is not that the politics should influence them, they are stepping out because their most important goal and mission is to prevent or keeping the health of the public. So this is very, very important to know also about that, and very important is for you also to know that the politics plays quite important role also in public health. We will go more about that later during the class, but just example is about the tobacco. So you will learn that back 1953 was already established. There is the connection between the influence of negative effects of tobacco in that time with lung cancer. Now we already know there are additional problems, cardiovascular disease, higher risk for occurrence of diabetes. But in that time, 1953, but it took time, many years, until 1980. That was actually established first smoking cessation classes and established that yes, we have to be aware about it and we have to do something about it. So you can see that big tobacco companies was playing a little bit politics a few years, maybe more than a few years, about that before this establishment was done. So you have to be aware about that too. And this is the beauty on public health, because if some of you like challenges, so with the politics in public health, there are quite a lot of challenges, and that's the beauty on that. So you never have like, that field and thinking like, oh, that would be the stereotype in my profession, public health. It's never stereotype. So public health disciplines, this is something that I mentioned to you that is very important to know about that also. If somebody will wake you up in the middle of the night, you need to know that. So it's epidemiology, statistics, biomedical science, environmental health, social and behavioral science, and health policy and management. So they are all important components. And of course, you as public health professionals, you will have the choices to be connected with any of that sections here. We will be talking about each of that specifically. So your actual textbook is divided based on that public health disciplines. But in general way, you need to know what is epidemiology doing, what is statistics doing, why we need to have statistics to collect the data in public health, why we need to have that, why we need to have that science. Of course, we would like to find out what is connected with the disease or what is under that under the disease, the agent causing that problem. So, and we need to develop the public health policy. So epidemiology, we will talk more about that, but generally it's the idea to find out, especially if we talk about acute diseases, infectious diseases, what is the agent, what is causing the problem, the disease. Statistics, the data, you need to have the data because you would like to compare the data. And maybe you will find out, well, there is the occurrence of the disease in Orange County, and you will compare that with the New York. What are the differences? Because if the data or statistics are different, you would like to find out what is the cause, what we can do, what kind of public health program we can develop. Biomedical science, we already talked about that. What do you think about this sentence? It is more important to know what sort of patient has a disease than what sort of disease a patient has. Do you agree with that? Yes? Yes? Why do you agree? Yeah.
Because by the lifestyle of the patient, you can connect the diseases instead of connecting the disease to the patient.
Yeah. So yeah, oh, you are amazing class. I love to be here. Yeah, this is great. Yes, of course. And this is also explaining another thing is, especially now that will be the season of the flu and cold, that there is the one person and maybe the person is running nose and having cold, and there are two people sitting, you know, one from one right side and one from the left side. And one person will get the cold and another person will not get the cold. Is it just the luck? I was lucky not to get the sickness. Or the person was keeping specific lifestyle, not just the protection, like not touching the face, you know, with the hands and washing the hands, of course. That's probably very important part there also. But maybe eating the food, improving the immune system. Maybe having the antioxidants, anti-inflammatory, enough of hours of sleep, because with sleep you are increasing your immune system. So yeah, so this is almost telling me like, is it just the luck or this is something that I was able to do about that? And again, you are going with this idea almost to that when I mentioned about the normal and typical aging. So this is something, you know, showing me again, this is quite valid. If you look on that, that's the wisdom almost 100 years back. So why we don't continue in that? Why we are not, you know, just telling public, please, this is so important, please follow that, you know, message. So we need to do more about specific public health education and promotion. So environmental health sciences, we will have section about that. There also we will have the guest speakers talking about water, about the air, safe food and all of these things. So that's part of the public health. Social behavioral sciences, one of your classmates mentioned that, it's also very important. How to engage people, be involved in the process. How instead of passive consumer, we will get the active participant taking care of their own health. So how to do that? This is the work of public health providers. Health policy and management, yeah, so especially later we will be talking about the medical cost and cost of medical care in the United States, and thinking like, well, if we implement the preventative measures, we will be able to decrease the cost. Plus, additional good thing is decrease the side effects of medication and improve the quality of public on its own. So health policy is very important. Any example of public health policy? I don't know, maybe I shared that last week about wearing helmets or not wearing helmets. This is one public health policy, seat belts, so I ask you some questions like that. And now we talk about preventative measures. Some of you, when I ask you, like, what do you see under the public health, you were thinking, oh, prevention of the disease. So be aware also that from public health perspectives, we have primary, secondary, and tertiary prevention. We are having there a little bit like politics, this playing with the words. In public health, we are not using the word curing to cure. We are doing the preventative things. And in order to minimize or decrease the risk of occurrence of disease, we are using primary, secondary, tertiary prevention. The word cure at this moment is connected just with the medical model, not with the public health model. But we are very happy with primary, secondary, tertiary prevention. So be sure also what is the meaning of each of them. So why it's important? Because again, story that I can share with you. When I was also working on the wellness community a few years ago for cancer patients. And the cancer patients, they came there, so we did, in that wellness center, we did a little bit like education about nutrition and lifestyle modification. And I told them, well, you know, but their feedback was like, well, I know already about it. I know that I shouldn't have the saturated fat in this amount that I'm consuming, but I already was diagnosed with cancer. So what's the purpose? Why should I do that? Why should I eat less dietary, you know, saturated fat if this is for prevention and I am already diagnosed with the cancer? So what do you think if you get a message like that from the cancer patient? What will be your response? I know you started to talk about it, but yeah.
I mean, all cancers aren't terminal, so if that person gets better and they obviously want to start off with a healthier life, and by eating the saturated fats and eating unhealthy food, they're going to have a difficult time to recover.
Yeah, excellent, excellent. So it's actually, we need to tell patients that the preventative things, the primary prevention is, you know, eating anti-inflammatory diet, antioxidative diet, low saturated fat, to prevent, to postpone the time that maybe the cancer will occur or manifestation is done. So that's primary prevention. Secondary is to prevent reoccurrence. Maybe they are already, you know, they were able to stop the spread of the cancer. So in order to prevent recurrence, you can start to do the same approach, or improve the quality of life, or you know, even going through chemotherapy with much better outcome than not having this preventative things. And the beauty on that is, if we talk about antioxidative diet, anti-inflammatory diet, it works whatever preventative things we are using. So if we call that primary prevention, it works to prevent disease. If we call that secondary, so it helps the occurrence of disease or decrease the symptoms. And if we talk that with tertiary, is actually even helping, you know, minimizing the process of the disability and all that. So that one lifestyle modification, it's like the formula that you can use it for all the principles, okay? So all the primary, secondary, tertiary prevention. When we talk about public health approach, and part of this will be actually your research paper, remember the topic is like, what is the public health problem? So usually the public health providers, and you will have some guest speakers from that they are working as a public health provider. So they need to define the problem. What is the problem? How to solve the problem? What could be, you know, the assessment of the situation? What should be done as a recommendation to the public? How to develop the public health policy? How to solve that? Or check maybe with other organizations how they were checking the problem, and what can be in the future done completely to prevent the occurrence of the problem. And always remember, there is monitoring. You need to monitor the progress, and evaluation. You need to do evaluation in any public health programs. Why? Because through the evaluation you will find out if there was something missing, and you can do that better next time. This is another very important part in public health, and you will see that I have video clips prepared for you after we finish chapter 1. And this is the cause, the chain of causation. So we always know that must be agent, it must be transmission, it must be reservoir, it must be environment. And how to understand that, we can talk, or you can imagine, and we will be talking about West Nile virus, talking about malaria. So you know, the way how the disease is spread. Who is spreading the disease? Is the mosquito? What is the breeding? Where the mosquito can be? You know, it's the area, the environment that the mosquito can live, and how the mosquito or how the agent can be infected. What kind of people can get the disease? Again, many times with the low immune system, compromised immune system on individual level, the person is just, that's the main rule, it's always more sensitive to get the disease. So we have to concentrate also not on all these parts, how the chain is developed, but also to keep good level of the immune system on individual part. Public health and terrorism, so it's another part that is very important in public health. So providing the surveillance, vigilance, that we can prevent any situations that can be jeopardized, for the public. So, and also we have the natural disasters. So again, it's very important to work as a proper public health team together to prevent any of that situation. So through the chapter 1, it's much more a little bit giving you the idea what everything will happen actually in this course. So we will go into detail on each of the topic. So now we are coming to the discussions. So describe some actions that governments have taken to ensure that people are safer and healthier today than people were 100 years ago. What do you think? What think it's quite good that was done? Yeah.
Better nutrition.
Yeah, so of course. So it's like now we don't talk anymore about the scurvy, for example. We can have only so-called artificial scurvy if somebody is taking so high dosage of vitamin C, and then suddenly they will stop to use that. So then you have artificial like bleeding from gingiva and having the scurvy, that is like deficiency, but it's big difference. It's like somebody is taking 10 grams of vitamin C and from one day to another they will stop that. So anytime if you are sometimes taking higher dosage, you have to decrease that slowly in order to prevent, any of that. So nutrition, yeah. Mm-hmm.
Are certain like testings and vaccination that they get infants when they're born?
Yeah, so we were, and again, I will be showing through the course the videos about the polio and smallpox and all the things. Like, yes, vaccination is very important. Yeah.
Like, especially recently, there's been a huge leap on policies taken. Like, for example, where you can smoke within the vicinity of a school, certain things that you could do. For example, precautions taken against pollution. Lots of them.
Yeah, so this is also very important. I mean, when I came to California back 1983, so it was still quite high, pollution in the air, especially coming from the Los Angeles areas, with public health policy to have that smoke certificates and all the changes. Now you can breathe much, fresh air. So yeah,
Right.
that's
Also, I've seen a lot more notices around than usual saying, oh, Prop 65, certain things cause cancer. It's a warning, and other types of warning on like food labels, nutrition facts. They used to not have those.
Yeah, thank you so much for the comments. That's true, because when I was sharing with you the information when I was at medical school, and I finished medical school back 1980, when I was buying the food, I have no clue what is in the food. I could do just a little bit like, have the components and thinking what are the, like carbohydrates, proteins, or maybe some of the components there, but no clue about that. And remember, it's not long time ago. It was around 1950 was discovering the vitamins and what is the influence for the human health. And when we talk about phytochemicals, that was just back 1980 that they are improving immune system. So that's amazing. Yeah. Any of you? I know that was. Oh yeah, please.
Sex ed.
What is that?
Sex ed. Like health classes.
Yeah. That's also that's important. Also that people are getting educated. It's amazing if you compare that just 30 years ago. I mean, it's amazing education at the school level also. Yeah.
The
FDA, yeah, of course, doing the, checking that, because some of you maybe will be in my drug abuse and its prevention class that I have on Wednesdays. that yes, just 100 years ago, there was like patent medicine and it was no regulation, so it's very important. Yeah, and oh, it's amazing. Yeah.
Health inspections, like in restaurants, do they have like different regulations now?
Yeah, this is also like, imagine that you are going to the restaurant and you are not worrying if I will have diarrhea next day or not. So yeah, it's amazing. It's very important. Yeah, thank you. Yes.
Fluorinated water.
Yes, that was also very important. That you can see the difference if you travel to other countries and you can think all the time about drinkable water. That's an amazing thing. Yeah. Yeah, CDC, if you travel now to any places and you can see like, yes, I'm going to this country, I need to have vaccination for yellow fever, otherwise, so preventative things. It's amazing, yeah.
Smoking restriction in certain areas?
Yeah, smoking, this is amazing also. So imagine like what I usually invite here the guest speaker about from the tobacco control policy. Management, and so she's always sharing, she's coming here and sharing the information like, can you imagine that maybe 34 years ago the students were sitting in the class and your neighbor was smoking. People were coming here and smoking. Or I remember when I came to United States, I was flying in the airplane, and that was always disaster for me because of course I didn't like that cigarette smoke, but you have the seat, and if I was not lucky and I got the seat, that immediately after that was starting the smoking section. So I was always checking like, oh, this is the person smoking, okay, this is the piece of the cigarette, the person will finish, oh, then I can breathe, and I check, and then another person started. So it was constant. So if you were flying to Europe, so 10 hours you were exposed to the smoking constantly. So now, it's luxury, it's amazing. So we should be aware about that. Who is behind that? Public health providers. Yeah.
Oh, sorry, I'm talking again.
Yeah, that's fine.
Another thing that has been mentioned yet is also in a lot of public facilities now, schools, businesses, they're recognizing emotional health or the deficiency of as an illness, and such things as social health. Right now, sexual harassment, bullying is a target in past it used to not be.
Yeah, thank you so much. This is, you can see like this is connected with 7 dimensions of health. So that's also a very important part. And many years back, there was no education about that. So you can see like how more and more, how this, the step by step the changes, it's very important improving the quality of life of the public. So you are just amazing class giving all the comments here. So this is another discussion question too. So think about that. You probably, here is the answer. So please be sure that you know about that. And the slide 16 is about all the components and disciplines in public health. And we should have the vaccine. I think, do we have, yeah, we have time. Okay. Oh, where do we have that? I forgot. Do you know?
Yeah,
vaccine?
Isn't that it?
No, that's West Nile virus.
That's what we
How come we don't have that? How come? No, it's not. It's West Nile virus.
And what's that one?
This one virus. I can't remember. How come it's not there? I don't know what happened. No, I don't have the West Nile virus in there. Okay, let me just, it should be for 5 minutes. Yeah, this is something like that. Oh, 8 minutes. No, I cannot. I will be not able to do it. How come? I don't understand. Okay. No, I cannot do that. I cannot do that. Yeah. Okay, we have some technical problems with the vaccine, so with the video clip. So I think I will finish at that level the class. I will show that to you immediately in the beginning next week. Next week, Thursday. So I will let you go from the class under one condition. Somebody can tell me that? Okay, so I can see the smile on your face. Okay, laughing, not just smiling. when you leave the class, trying to breathe fresh air, walking fast. Some of you be fortunate that your class is as far as possible, and and thinking what kind of nice, colorful picture of fruits and vegetables you will have for your lunch. Okay, and I hope that you remember the 7 dimensions of health. And I will see you on Thursday. Thank you.